guys. First of all, thanking patient and patient attenders for giving the permission to do this medical video. And we'll have some interesting features like he's a 18-year male patient. He is present with complaining of sudden onset of acute onset of breathlessness. So quickly have to classify whether this breathlessness is because of any respiratory, cardiac, anything. So in this age, should be no any cardiac disease to be suspected, but respiratory breathlessness to be think. So in this patient, he is not having any history suggestive of respiratory breathlessness. Like he is not having fever, he is not having cough cold, he is not having any chest pain, anything. So only complaining is he is having breathlessness. That too sudden onset. So we have to think that sudden onset breathlessness in this patient we have to classify mainly only in this patient, as the patient is having young age. Only juvenile diabetic patient, patient that is called type 1 diabetic patient, they will present in severe decay patient. In this patient we check RBSL, so sugar is normal, so decay is out now. Only one thing remaining is hypocalcemia. In this patient he got an hypocalcemia, so it may be because of low calcium conditions he is having breathlessness. So what you have to do is, when you have to suspect any patient of breathlessness, so what only simple diagnosis that is based on the clinical is, we have to check the two signs. One is Chopstick sign, one more is one is Chopstick sign, one more is Trousseau sign. So what I have checked is, I have checked any irregular rhythms or anything, any other cyanosis is getting or not. There is no tongue shows up. Okay. Tongue is normal and nails are also normal. There is no any cyanosis. So hypoxia is like saturation also normal. There is no any hypoxia. Only thing is you have to diagnose two clinical signs now. One more is Trousseau sign, one more is Chopstick sign. In this patient we have to see Chopstick sign. If you tap here, just come here. If you tap, there will be a movement of this upper lip. In this patient, Chopstick sign is not there. But you have to do any Trousseau sign. You have to any movement of the you have to tie the cuff, BP cuff. I will tie here. So his BP is 120/80. I will inflate about 110/120, and you can see this classical movement of this hand. And you have to wait for 10 minutes. Give here, I will show. You can see here he is developing Trousseau sign. You can see this clinically. You can see this. Now clinically he developed Trousseau sign. So you can see. So this is what I am showing is. Now he developed fully a classical sign. You can see this classical sign of Trousseau sign. So what you have to do is, you just releasing now. So in this patient, you should, as patient is having breathlessness, without checking any saturation, you should not give any oxygen, and any bronchodilators, nebulization, anything should not be done. Only thing is, he is getting low calcium, hypocalcemia signs. We have to supplement the calcium now. So we will give calcium injection, and patient will be the fine. And so these are the very clinical present here. Thank you so much.